With the issue of separation for Ab and Britt, initially as babies, we were told kind of inseparable. We went with that.
For 34 years, Abby and Brittany lived in one body, moving in perfect agreement, thinking side by side, never knowing a moment alone. The world watched them grow, but few understood the silent strength it took to live that way every day. Then something happened that no one thought could ever happen. A risk was taken that could end everything. And now, after the surgery, nothing is the same again. How did they reach the point where separation became possible? What truly happened during those tense hours, no one was allowed to see. Join us as we uncover the moment their shared life changed forever. The rare condition that joined their bodies. Abby and Brittany Hensel were born as a very rare type of conjoined twins known as dicephalous parapagus twins. This condition means two heads on one torso. It is one of the rarest forms of human birth ever recorded. Their case is studied in medical schools because it shows how the human body can develop in an unusual but still functional way. Their story begins before birth, at the earliest stage of life. Identical twins normally form from one fertilized egg. After fertilization, that single egg is meant to split fully into two separate embryos. When this split is complete, two separate babies develop, each with its own body. In the case of dicephalous parapagus twins, the egg begins to divide, but the separation stops halfway. The result is two individuals who are not fully separated. They develop two heads, two brains, and two upper spinal columns, but they share one lower body. This is what happened in the case of Abby and Brittany. From the chest downward, they share a single torso. However, inside that torso, their anatomy is not as simple as one body. Some organs are shared, while others are duplicated. Understanding how their body is arranged explains why doctors believed separation was not possible. They have two brains and two spinal columns at the top. These two spinal columns run down and gradually join into one pelvis. Each brain controls one side of the body. Abby controls the right arm and the right leg. Brittany controls the left arm and the left leg. This division of control is something they learn to manage from infancy through constant practice and cooperation. They do not have one heart. They have two hearts, each supporting its own upper body. They also have two stomachs, which connect to a shared digestive system lower down. They share one liver, which performs its function for both of them. They share one set of intestines, one bladder, and one reproductive system. They also share one pair of lungs which supply oxygen for both of their bodies. Their rib cage and chest cavity are shaped to support these organs in a way that keeps both of them alive and functioning. Because of this arrangement, their bodies are both separate and shared at the same time. Their nervous systems are especially complex. Each brain sends signals to its own side of the body. But those signals must work in harmony for movement to happen smoothly. Walking, sitting, reaching, and balancing require constant coordination between them. If one side moves without the other agreeing, they would lose balance. From the time they were babies, they had to learn this coordination naturally. They learned how to crawl, stand, and walk by working together. One side could not move without the other adjusting. Over time, this became normal for them. What would be difficult for others became automatic for them. Doctors who examined them when they were infants quickly understood the seriousness of their condition.
And how does that happen? Well, there's absolutely no degree of fusion of their spinal columns. They're completely separate.
In many cases of conjoined twins, separation is attempted early in life if the organs are not too deeply shared. In their situation, the shared liver, shared lower organs, shared pelvis, and the way their spinal nerves connected made separation extremely dangerous. The pelvis was a major concern. Their two spinal cords merged into one structure in the lower body. This meant that the nerves controlling movement, bladder function, and lower body stability were deeply intertwined. Attempting to separate this could lead to paralysis, loss of organ function, or death for one or both of them. Their shared liver also made separation risky. The liver is a vital organ with a complex blood supply. Dividing it safely is one of the hardest procedures in surgery. In their case, the liver supported both bodies at once. Any mistake could cause severe bleeding that would be impossible to control. The shared reproductive system, bladder, and intestines added even more difficulty. These organs are not easily divided into two fully working systems. Rebuilding them for two separate bodies would require medical technology that did not exist when they were young. Because of all these factors, doctors reached a strong conclusion early in their lives. Separation was considered medically impossible. The risk was too high. The chance of survival was too low. Instead of planning surgery, doctors focused on helping them live a healthy and full life as they were. As they grew older, they proved that their bodies could function in a stable way. They learned to walk, write, eat, and perform daily activities with impressive coordination. They went to school, learned to ride a bicycle, and later learned to drive a car. Their ability to cooperate made their unusual anatomy workable in everyday life. Medical experts continued to study them over the years. Their case remained an example of how complex and delicate conjoined anatomy can be. Every specialist who examined them repeated the same conclusion. Separation would threaten their lives because too many vital systems were shared in ways that could not be safely divided. For more than 3 decades, this belief remained unchanged. Advances in medicine improved many types of surgery, but their specific anatomy still presented challenges beyond what surgeons believed they could overcome. The shared pelvis, the merged spinal nerves, the shared organs, and the need to rebuild entire systems for two bodies kept the idea of separation out of consideration. For 34 years, one medical truth remained accepted without debate. Abby and Brittany could live full lives, but they could never be separated safely. If doctors were certain separation could never happen, what changed after 34 years? The 72 hours that changed medical history. The operation that separated Abby and Brittany required planning at a level rarely seen in modern medicine. Because of the complexity of their shared organs and nerves, the hospital environment had to be tightly controlled. Access to the surgical wing was restricted. Movement in and out of the area was limited to essential staff. This was done to protect focus, privacy, and safety. A case like this demanded calm, order, and strict attention to detail. A large team of surgeons, anesthetists, nurses, engineers, and specialists worked together. Experts in neurosurgery, vascular surgery, organ reconstruction, and rehabilitation were involved. Each group had a specific role. No single doctor could handle such a case alone. This level of teamwork is common in complex conjoined twin operations where different systems of the body must be handled at the same time. Robotic surgical tools were used for extreme precision. These tools can make movements smaller and steadier than human hands. They are often used in delicate procedures involving blood vessels and nerves. In this operation, they helped reduce blood loss and allowed careful separation of shared tissues without sudden damage. Artificial intelligence systems assisted the team by mapping nerve pathways before and during surgery. These systems can create detailed images that show how nerves connect and where signals travel. This was important because the twins' lower spinal nerves were closely joined. Any wrong cut could cause permanent paralysis or loss of organ control. The mapping allowed surgeons to plan each step before touching the tissue. The first stage focused on separating shared blood vessels in the chest and abdomen. This required extreme care because both bodies depended on stable blood flow. Surgeons had to create new pathways so that each twin would have an independent circulation after the split. Special clamps and temporary support lines were used to control blood movement during this process. As the operation continued, attention moved to the spinal region. This was the most dangerous part. Their two upper spinal columns merged lower down near the pelvis. Surgeons had to gently separate nerve bundles while protecting function. Monitoring equipment checked brain activity, muscle response, and reflex signals every second. The room remained quiet, except for machine sounds and brief technical communication. During this long process, a crisis occurred. Abby's heart rhythm became unstable and then stopped. Immediate resuscitation steps were taken. Cardiac specialists worked quickly to restore her heartbeat, while the rest of the team maintained stability for Brittany. This moment showed how fragile the situation was. A delay of even a few minutes could have ended the operation. Her heartbeat returned, and the work continued without pause. The next phase involved organ reconstruction. Because they shared a liver, intestines, bladder, and reproductive system, new structures had to be created for each twin.
The physiology of a body is very complex, especially when it comes to female reproduction. It's not simply organs, but it's regulated by several centers in the brain.
Surgeons divided the liver carefully, ensuring both sides kept enough tissue to function. Artificial support materials were used to rebuild areas that could not be naturally separated. These materials are designed to work safely with the human body and allow healing over time. Breathing support systems and controlled anesthesia kept both twins stable while the reconstruction continued. Every change in blood pressure, oxygen level, and nerve response was monitored closely. Teams rotated to prevent exhaustion, but the plan remained steady and organized. As the hours passed, the surgical field slowly changed. What was once a single connected lower body began to take the shape of two. Muscles were separated and reattached. Skin grafting techniques were prepared for closure. Synthetic support layers were added where natural tissue was not enough. This careful rebuilding was just as important as the separation itself. Finally, the last stage focused on the pelvis and legs. This required dividing bone structure and reconstructing support for two independent lower bodies. Special orthopedic tools and stabilizing frames were used. Each movement had to protect balance and long-term mobility. When the separation was complete, two surgical tables held two patients for the first time. Vital signs were checked again and again. Independent blood flow, breathing, and nerve responses confirmed that both bodies were functioning on their own. The long process ended with careful closure of surgical sites and transfer to recovery rooms. The operation had succeeded, but the condition of their minds and bodies after such a change remained uncertain. But surviving the surgery was only the beginning. Could their minds accept a life no longer shared? Learning to live in bodies that felt foreign. The period after surgery was more difficult than many expected. During the first month, neither Abby nor Brittany could move without assistance. Their muscles were weak from the long operation. Their nerves had to adjust to controlling a body that no longer required cooperation with the other. Breathing exercises were the first step. Sitting up, turning the head, and lifting an arm required effort. Actions that most people do without thinking became daily challenges. Nurses and therapists stayed close at all times to prevent strain and injury. The emotional effect was just as strong as the physical one. For their entire lives, they had felt constant physical closeness. Now there was space between them. This caused deep distress. They often felt as if part of their body was missing. Their brains needed time to accept the new reality. To reduce anxiety, mirrors were placed in their rooms. When they looked up, they could see a familiar face. This helped their minds adjust slowly. Therapists also recreated familiar sounds and routines from their past life to make the environment feel less strange. After 6 weeks, they were allowed to meet in person. This was the first time they saw each other as separate individuals. The moment was quiet and emotional. They reached out to touch hands, confirming that both were still present and alive. Physical therapy became more intense after this meeting. They practiced sitting without support, then standing with braces. Walking practice was painful because their muscles and nerves were learning new patterns. Each step required balance that they had never needed before. To help them feel connected at night, a video system was placed in their rooms. They could see each other at any time. This simple support reduced fear and helped them sleep. Gradually, their confidence increased. Months passed with daily exercises. They learned how to hold objects, how to turn, how to sit comfortably, and how to lie down alone. Their therapists guided them through every action with patience. Progress was slow but steady. By the end of the year, a major milestone arrived. On the first day of January, they were able to take independent steps without support. Medical staff watched closely as they walked carefully across the room. This moment showed that their bodies were adapting. Rehabilitation continued with focus on strength, balance, and independence. They recorded their progress to see improvement over time. Each small success built confidence. When they finally left the hospital, a new challenge was waiting, a life that no longer fit the way it used to be. Family, marriage, and an identity crisis. Abby and Brittany Hensel have always lived in a way that required constant cooperation. Their shared body meant shared routines, shared space, and shared decisions from childhood into adulthood. As they grew older, this closeness shaped not only their physical life, but also their emotional and family life. Every change in one sister's world affected the other in direct ways. A major turning point came when Abby married Josh Bowling in the year 2021. This marriage was a real and documented event. Photos later shared publicly confirmed that Abby had entered into a legal marriage. This created a new situation that their family and even legal experts had never faced before. Because Abby and Brittany share one body, the question of marriage raised complex issues. Legally, Abby was recognized as the wife. The marriage certificate carried her name. This did not remove Brittany from the situation physically or emotionally, but in legal terms, the relationship belonged to Abby. For the first time in their adult lives, official documents recognized one sister in a role that did not equally apply to the other. This situation required careful understanding within the family. Josh did not enter a typical marriage. He understood from the beginning that Abby's life could never be separated from Brittany's presence. Daily life required respect, patience, and emotional balance from everyone involved. For Brittany, this change created a quiet identity struggle. She had always shared life decisions equally. Now, an important adult milestone belonged mainly to her sister. She remained present, supportive, and involved in daily life. But the emotional meaning of marriage rested more on Abby's side. Their parents also faced emotional adjustment. From childhood, they raised their daughters as a unit. They learned to speak to them together and plan for them together. Marriage forced a shift in thinking. They had to recognize Abby's new role while still treating both daughters with equal care. This balance was not simple. It required time, honest conversations, and patience. Their younger sister Morgan also reacted strongly to these changes. Growing up, she saw Abby and Brittany as one team. Seeing Abby move into a new stage of life that did not fully include Brittany felt unusual. Morgan had to learn that adulthood would not look the same for both sisters. This brought tension at times, but also deeper understanding as the family talked through their feelings. Because of these emotional pressures, the family sought guidance from counselors. Therapy helped them express feelings that were difficult to explain. It allowed each person to speak openly about confusion, sadness, and hope. This step helped the family adapt to a new structure without losing closeness. As time passed, Abby's married life settled into a rhythm. She continued working as a teacher. Daily routines remained familiar, but now included her husband as part of the household. Brittany remained part of that environment, sharing the same physical space, but processing her emotions privately. Public attention made everything more intense. Many people asked personal questions about how marriage worked in their situation. The sisters chose to keep many details private. They focused on protecting their peace rather than answering public curiosity. For Brittany, this period brought a quiet feeling of being left behind. She supported her sister completely, but she also had to face the reality that some life experiences might feel different for her. This did not create anger between them, but it created moments of reflection and emotional growth. Their bond remained strong, but their personal identities were becoming clearer.
Their personalities make them inspirational, and the things they do, they never give up, they keep trying. Anything they wanted to do, they go out and do it.
They were learning that even in a shared body, individual emotions and paths still exist. While Abby stepped into motherhood, Brittany made a decision that would take her far away from home. Brittany's new world and the first taste of independence. As Abby settled into married life, Brittany began to focus more deeply on her own interests and personal growth. Even though they share one body, they have always had different tastes, thoughts, and preferences. This period of life allowed Brittany to explore her individuality more openly. Brittany showed strong interest in science, health, and how the human body works. Over time, she became involved in educational and awareness activities connected to medicine and rare conditions. She worked with groups that focused on understanding conjoined twins and supporting families facing similar situations. This gave her a sense of purpose that belonged clearly to her. She also began spending more time traveling for speaking events and awareness programs. These activities exposed her to new places, new people, and new ideas. It allowed her to express herself outside the daily routine at home. During this time, she met Ryan, a man who shared her interest in science and learning. Their friendship developed slowly through conversations and shared curiosity about the world. Ryan respected her situation and treated her as an individual person, not only as part of a pair. This was important to Brittany because it helped her feel seen for who she was. One small but meaningful change happened when Brittany began choosing her own clothing style more boldly. Abby had always liked bright colors, especially red. Brittany began choosing darker shades and different designs. This may seem simple, but for them, it was a sign of growing independence. Clothing became a way to show personality without words. Shopping also became an expression of choice. Selecting items based on her own taste allowed Brittany to feel a sense of control that was sometimes difficult in a shared body. These small decisions added up to a stronger personal identity. Living without shared decisions is not fully possible for them, but Brittany learned to speak more clearly about her preferences. She became more confident in saying what she liked and what she did not. This improved their communication and strengthened their understanding of each other. Even with these changes, the sisters remained deeply connected. Every night, they spent time talking and reflecting on their day. Conversations helped them stay emotionally close, even as their interests grew in different directions. Brittany's expanding world did not weaken their bond. Instead, it showed that individuality and unity can exist at the same time. She was building a life that felt more personal, while still honoring the connection she shared with Abby. Just as the world thought their story had settled, unexpected news shocked everyone again. The pregnancy that no one thought was possible. News about Brittany's pregnancy created immediate surprise among medical observers and the general public. For most of their lives, people had assumed that Abby and Brittany's shared reproductive system would make independent pregnancy unlikely or medically complicated. Because they were dicephalous parapagous twins, they shared one set of lower organs, including the reproductive organs. This arrangement had always raised questions that were rarely discussed openly. When reports of Brittany's pregnancy began to circulate, the first reaction from many people was disbelief. Doctors understand that shared anatomy in conjoined twins can vary, but cases involving a shared reproductive system are extremely rare. For decades, this part of their biology had been discussed mainly in medical circles with caution and respect for privacy. Medical professionals reacted with curiosity and careful interest. A pregnancy in this situation would require close monitoring because of the unusual internal structure. Blood flow, organ support, and physical balance would all need attention. Specialists in maternal health would need to consider factors that do not exist in typical pregnancies. Public reaction spread quickly through news outlets and social media. Many people expressed admiration and surprise. Others asked questions about safety and long-term health. The discussion showed how little most people understood about their anatomy and daily life. Brittany chose to remain quiet and allow medical professionals to handle information carefully. During this time, Abby showed clear support for her sister. Their bond remained steady, and family unity became important again as attention increased. Abby understood the emotional weight of this moment and stayed close to Brittany, through regular communication and visits. The situation also brought renewed interest in their story from filmmakers and producers. Plans for a documentary series about their lives expanded to include this new chapter. The goal was to allow them to present their experience in their own way, rather than allowing public imagination to create false ideas. Cameras followed selected moments under strict privacy rules. At the same time, Abby began planning a personal medical procedure for herself. She considered facial reconstruction surgery to help create a stronger sense of individual identity. Because they share many physical features, Abby wanted changes that would help people recognize her more easily as a separate person. This decision showed how both sisters were working toward personal growth in different ways. The pregnancy also encouraged them to speak more openly about support for other families with conjoined twins. They understood how rare their lives were and how much confusion surrounds such conditions. Together, they began developing plans for a foundation that would help with medical research, education, and financial assistance for families facing similar situations. The foundation focused on providing real information about conjoined twinning, early medical care, and long-term support. Their experience gave them insight into challenges that most people never see. They wanted other families to feel less alone and more informed when facing difficult decisions. As Brittany's pregnancy progressed, careful monitoring continued. Doctors checked organ function, blood flow, and physical comfort regularly. Each visit added to medical knowledge because so few similar cases exist. The process remained private, but the impact was widely felt. For Brittany, this period was emotional and meaningful. She experienced the normal feelings of excitement and concern that come with pregnancy, but also carried the weight of public attention. She focused on her health, rest, and calm surroundings. Family support helped reduce stress. Abby's role during this time showed the strength of their relationship. But to understand how extraordinary all this is, you must understand something most people never knew about how their shared body actually worked for 34 years. How their organs worked, and why separation was once impossible. For most of their lives, Abby and Brittany Hensel lived with a body that worked in a way very few people could understand. From the outside, it appeared unusual. Inside, it was a highly organized system that allowed two people to survive in one torso. Doctors studied their anatomy for years because it showed how the human body can adapt to rare conditions and still function in a stable way. They were born as dicephalous parapagous twins. This means 2 heads, 2 brains, and 1 shared lower body. Their upper bodies were separate in many ways, but from the chest downward, their organs were arranged to support both of them at the same time. Each twin had a heart. These hearts worked together inside one chest cavity. Blood flowed through a shared network of vessels that supported both brains and the rest of the body. This system had to remain balanced at all times. If blood pressure changed for one, it could affect the other. Their bodies learned to regulate this naturally as they grew. They had 2 stomachs. Each twin could eat and feel hunger separately. Food from both stomachs moved into one shared digestive system lower down. They shared 1 liver, 1 set of intestines, 1 bladder, and 1 reproductive system. This meant that digestion, waste removal, and hormone balance happened in one combined pathway for both of them. Their nervous system was even more complex. Each brain controlled one side of the body. Abby controlled the right arm and right leg. Brittany controlled the left arm and left leg. Their 2 spinal cords began separately at the neck and slowly joined together as they moved down toward the pelvis. Because of this, nerve signals from both brains had to pass through areas that were closely connected. For simple actions like walking, both brains had to agree at the same time. If one leg moved without the other responding, they would fall. From early childhood, they practiced this coordination without being taught. It became natural through daily life. They learned to crawl, stand, and walk by working together. Over time, their brains developed a rhythm. They did not need to speak before moving. Their nervous systems adapted so well that actions became smooth and balanced. This level of coordination is rare and shows how flexible the brain can be. The pelvis was one of the most important reasons doctors believed separation could not be done. Their two spinal cords merged into one nerve network in this area. These nerves controlled the legs, bladder, bowel function, and stability. Cutting through this region without causing permanent damage was considered nearly impossible. The shared liver also presented serious risk. The liver has many blood vessels running through it. Dividing it into two working parts requires extreme precision. In their case, the liver supported both twins at once. A mistake could lead to severe bleeding that would be difficult to stop. The shared reproductive system added another layer of complexity. These organs are delicate and deeply connected to blood supply and nerves. Separating them would mean creating two complete systems where only one existed. For many years, medical technology could not support such reconstruction. Doctors often explained the dangers clearly. They warned of paralysis if the spinal nerves were damaged.
One presumes the outlook's better if you have 4 or even 3 arms than if you have 2, because it indicates a greater degree of duplication of the upper body. Abby and Brittany had 3, and that may have something to do with why they're doing so well.
They warned of brain damage if blood flow changed suddenly. They warned of death if organ division failed or if infection occurred after surgery. These risks were not small. They were serious enough to stop any discussion of separation for decades. Because Abby and Brittany were healthy and able to live full lives together, surgeons did not see a reason to attempt a dangerous operation. The goal of medicine is to improve life, not to take unnecessary risks. Since they were stable, the safest decision was to allow them to continue living as they were. As years passed, improvements in medical imaging, robotic tools, and nerve mapping changed what surgeons could see and do. Still, their case remained one of the most difficult examples in medical study. Many experts believed it would remain impossible throughout their lifetime. Two brains shared control without confusion. Shared organs supported two lives without failure. Coordination between them became so smooth that most people forgot how much effort it required. For more than 30 years, this shared system worked without major breakdown. From one body to two lives, Abby and Brittany did not just survive the impossible, they rewrote what medicine believed was impossible. If you enjoyed this video, like and subscribe, and also click the next video shown on your screen.